Very good morning to my dear students. Welcome back to my channel. In this video, I would like to discuss about the latest 2021 to 22 model question paper for the MPHW second year students third paper, that is the health center management. మరొకసారి హాయ్ అండి అందరికీ. ఈరోజు మనము ఎంపీహెచ్డబ్ల్యూ సెకండ్ ఇయర్ వాళ్ళకి థర్డ్ పేపర్ ఆరోగ్య కేంద్ర నిర్వహణలో ఉన్న థర్డ్ పేపర్ గురించి ఈరోజు మన క్వశ్చన్స్ అదేవిధంగా ఆన్సర్స్ కూడా ఈరోజు వీడియోలో మనం తెలుసుకుందాం. ఓకేనా? Especially this video is for the only Telangana state students. So let me see one by one. This is a model latest 99.9% is most expected and very important gunshot questions from this unit, from this question paper. So let me see one by one. Section A, already you know very well about the pattern of the examination, even though once you can go through this session. Section A, so like 10 marks questions, 2 marks questions will be there. So they have given 15, out of 15 you have to write any 2 questions. Okay, any 10 questions you have to write. Okay, section A లో జనరల్ ప్యాటర్న్ ఏ విధంగా ఉంటుందంటే సెక్షన్ ఏలో చాయిస్ అనేది ఉండదు. 10 క్వశ్చన్స్ ఇస్తారు, 10 క్వశ్చన్సే రాయాలి. ఓకేనా? బట్ దిస్ ఇయర్ academic students, the Telangana government like a interboard released the 70% choice for the people to pass out to all the students. ఓకే, అందరు పాస్ అవ్వాలనే ఉద్దేశం కోసం చాలా చాయిస్లు ఇవ్వడం జరిగింది. కాబట్టి ఈ యొక్క క్వశ్చన్ పేపర్ ఏదైతే ఇస్తున్నా ఈ యొక్క మోడల్ క్వశ్చన్ పేపర్ చదవండి. ఎగ్జాక్ట్గా ఇర్రెగ్యులర్ స్టూడెంట్స్, ఓకే, సడన్గా వచ్చే ఎగ్జామ్స్ స్టూడెంట్స్కి ఇది చాలా యూస్ఫుల్ అవుతుంది. ఓకేనా? కాబట్టి ఒకసారి ఇవన్నీ చూసి టెక్స్ట్ బుక్ ఓపెన్ చేసి చదవండి. ఒకవేళ ఇఫ్ యూ నాట్ గెట్ ద ఎనీ ఆన్సర్స్ ఫ్రమ్ యువర్ టెక్స్ట్ బుక్, ఐ విల్ ప్రొవైడ్ ద ఆన్సర్స్ ఆల్సో. Okay, don't skip the video until the finishing of this video. You have to watch, then you will get the idea regarding this content and explanation regarding particular examination pattern. Okay, so let me see. So list the elements of the management. Okay, నిర్వహణ ఎందలి అంశంలో పేర్కొనండి అంటే అంశంలు అంటే మనకు ఎలిమెంట్స్ అంటే మేనేజ్మెంట్ ఇస్ నథింగ్ ద గెటింగ్ ద థింగ్స్ డన్ బై అదర్స్, అంటే ఇతరులతో పని చేయించి మనం అనుకునే లక్ష్యాలు సాధించడాన్ని ఓకే మనము మేనేజ్మెంట్ అనుకున్నాం. కాబట్టి మనము లాస్ట్లో ఫస్ట్ క్వశ్చన్ పేపర్ చదువుదాం, తర్వాత లాస్ట్ మనం ఆన్సర్స్ కూడా చూద్దాం. ఓకేనా? డిఫైన్ సబ్సెంటర్ ఉపకేంద్రం అంటాము. ఓకే, డిఫైన్ ప్రైమరీ హెల్త్ సెంటర్ ప్రాథమిక ఆరోగ్య కేంద్రంను. మెన్షన్ ది ఆబ్జెక్టివ్స్ ఆఫ్ ది యాంటీనేటల్ క్లినిక్ గర్భిణీ సేవల క్లినిక్ యొక్క ఉద్దేశాలు. నేమ్ ద వ్యాక్సిన్ గివెన్ టు ప్రెగ్నెంట్ ఉమెన్. డిఫైన్ హెల్త్ టీమ్ ఆరోగ్య బృంద నిర్వచింపము. ఎక్స్పాండ్ ఆశాని విస్తరింపు. రైట్ అబౌట్ 108 సర్వీసెస్ 108 అంబులెన్స్ సేవల గురించి రాయము. డిఫైన్ ఫ్యామిలీ ప్లానింగ్ కుటుంబ నియంత్రణ నిర్వచింపము. డిఫైన్ ఫర్టిలిటీ రేట్ సంతానోత్పత్తి రేటు నిర్వచింపము. ఎక్స్పాండ్ టీబీఏని విస్తరింపము. వాట్ ఈస్ ఓఆర్ఎస్ అనగానేమి. ఎక్స్పాండ్ ఎండిటి అని విస్తరింపము. డిఫెన్స్ స్టాఫ్ డెవలప్మెంట్ సిబ్బంది వికాసము సిబ్బంది పురోగభివృద్ధిని నిర్వచింపము. వాట్ ఈస్ మీటింగ్ ఆర్ వాట్ ఈస్ సెమినార్ మీటింగ్ ఆర్ సమావేశం అనగానేమి. కాన్ఫరెన్స్ అనగానేమి. ఓకే, నెక్స్ట్ కమింగ్ టు సెక్షన్ బి క్వశ్చన్స్. ఎక్స్ప్లెయిన్ ద ప్రిన్సిపల్స్ ఆఫ్ ది మేనేజ్మెంట్. ఓకేనా? నిర్వహణ యొక్క నియమాల గురించి రాయండి. రైట్ ద ఫంక్షన్స్ ఆఫ్ ప్రైమరీ హెల్త్ సెంటర్ ప్రాథమిక ఆరోగ్య కేంద్రం యొక్క విధుల గురించి రాయండి. రైట్ ది ఫంక్షన్స్ ఆఫ్ ది ఎంపీహెచ్డబ్ల్యూ ఫీమేల్ ఎయిడ్ క్లినిక్ యాంటీనేటల్ క్లినిక్ గర్భిణీ స్త్రీ సేవల క్లినిక్ ఎంత ఆడ ఆరోగ్య కార్యకర్త విధుల గురించి రాయండి. నెక్స్ట్ కమింగ్ టు ది 19th క్వశ్చన్. రైట్ ది ఫంక్షన్స్ ఆఫ్ ది WHO ప్రపంచ ఆరోగ్య సంస్థ యొక్క విధులను గురించి రాయండి. రైట్ అబౌట్ ది 104 సర్వీసెస్ 104 సేవల గురించి విశదీకరించండి. రైట్ అబౌట్ ది యూసేజ్ ఆఫ్ ది వ్యాక్సిన్ క్యారియర్ యొక్క ఉపయోగాల గురించి రాయండి. ఎక్స్ప్లెయిన్ అబౌట్ ది 4 టెంపరీ ఫ్యామిలీ ప్లానింగ్ మెథడ్స్ ఏవైనా 4 తాత్కాలిక కుటుంబ నియంత్రణ సేవల గురించి రాయండి. ఎక్స్ప్లెయిన్ ద కోఆర్డినేషన్ ఆఫ్ ది ఎంపీహెచ్డబ్ల్యూ ఫీమేల్ విత్ స్కూల్ టీచర్. ఓకే, పాఠశాల ఉపాధ్యాయునితో ఆడ ఆరోగ్య కార్యకర్త యొక్క సమన్వయం గురించి వివరించండి. రైట్ అబౌట్ ద రెస్పాన్సిబిలిటీస్ ఆఫ్ ది ఫీమేల్ హెల్త్ వర్కర్ నేషనల్ డయేరియల్ డిసీజ్ కంట్రోల్ ప్రోగ్రామ్ జాతీయ విరోచన నియంత్రణ కార్యక్రమంలో ఆడ ఆరోగ్య కార్యకర్త యొక్క బాధ్యతల గురించి వ్రాయము. ఎక్స్ప్లెయిన్ అబౌట్ ది మెథడ్స్ ఆఫ్ ఆర్ స్టాఫ్ డెవలప్మెంట్. ఓకే, సిబ్బంది పురోగభివృద్ధిలో గల పద్ధతుల గురించి వివరించింది. దిస్ ఇస్ ద టోటల్ లైక్ వెరీ ఇంపార్టెంట్ అండ్ 99.9% ఎక్స్పెక్టెడ్ క్వశ్చన్స్ అనేవి యొక్క యూనిట్లు యొక్క వీడియో నుంచి మీరు తెలుసుకోవచ్చు. కాబట్టి స్కిప్ చేయకుండా లాస్ట్ వరకు చూడండి. ఐ హ్యావ్ గివెన్ ది క్వశ్చన్స్ అండ్ ఐ వుడ్ లైక్ టు గివ్ ద ఆన్సర్స్ ఆల్సో ఇన్ దిస్ వీడియో. సో లెట్ వి సీ ది ఆన్సర్స్. Okay, so first one is the section A questions. So list of the elements of the management. So management is nothing but getting the things done by others. So in these elements are nothing but the when you are planning, so if you want to do the any activity, you should have some of the components, some of the elements in your mind. The first one is the team spirit should be there. So this one also correct, but along with this answer you have tried some of the points of whatever I am explaining in this video. So first one is the team spirit should be there. So if you have the team spirit, then only you can finish the work with the help of the other people. It's clear na? Team spirit should be there. First point is the team spirit, not planning, organizing, staffing, directing. This is also correct, but whatever I am telling, this is the first you have to write. Team spirit should be there. Okay, team spirit is nothing but the I am also belongs to the particular team, so that you have to, then only you can able to do the activity with a positiveness. So second one is the like understanding, mutual understanding should be there. Okay, if you have the mutual understanding, if you have the negative thoughts in your group also, easily you can communicate, easily you can solve the problem with the other people. Okay, not only team spirit, you have to have the, you have to develop the mutual understanding with the group members within the team members. It's clear? Okay, my first point is team spirit should be there. So team spirit is nothing but I am also belong to the particular team. Okay, then only you may have the ability to complete the work within the fraction of time. So next, coming to the mutual understanding, you have to develop the mutual understanding among the family, among the team members. Okay. Okay, next third one is the, if you have the any okay, you have to develop the aims. If you have the aim, then only you can able to success the within the time period. Okay, so this without aim or without like any ambition, nobody will success in the nobody will success in personal way. If you have the objective, then only you can able to do the, if you can able to put the efforts to success in the particular team. Okay, so first third one is the, you have to frame the objective or aim. Okay, next third one is the, if face to face interactions. Okay, if you have the any doubts, without hesitating, you have to ask the team members. Face to face conversation you have to develop. Okay, so this is like a management is nothing but the getting the things done by others. So you have to, if you want to finish the work, so you have to, sometimes you have to take the help of the other people. Okay, so that is the reason, not only team spirit, not only mutual understanding, not only framing the objectives, you have to, if you have any doubt, some person is not doing the work within the time period, if you have that concept, immediately you have to rectify that with the other people. Face to face conversation is very very important to solve the problem. It's clear na? Okay, so next, coming to the like a understanding, cooperation should be there. Okay, so this management, he cannot do the activities, only one person he cannot do the activities. Cooperation other people also, we can complete the work within the fraction of time. So that is the reason, mutual understanding, not only mutual understanding, cooperation of the other people within the team members. It's clear? Okay, and trustworthy, you have trust. Here the manager will be there, no, he have to trust the other workers. Okay, without trusting the, he cannot do the activities in successful way. So you have to trust the among the all the, you have to trust the each and every worker in the team members. It's clear? So these are the very very like elements of the management. It's clear? First one is the team spirit, second one is the mutual understanding, and third one is the frame the objectives, and fourth one is the face to face interactions and coordination, communication, and last one is the trust. You have to trust all the workers in the team members. It's clear? So these are some of the elements in the management sector. Okay, and other one also you can, after that you can write this: planning, organizing, staffing, directing, coordinating, controlling, and reporting and recording. These are the other elements of the management. It's clear now? Okay, so in this also, so next, so 2 marks questions, no? So this is enough for you people. If they will ask 6 marks questions, like as other steps also will be there, but don't expect this question for the 6 marks. That is the reason I am not going to explain in detail for the 6 marks. Okay, so you may have the chances to get the 2 marks only. Next, define subcenter. Okay, subcenter, it will cover in order to provide the care for the rural people. It may be general or plain area, so general and tribal area, hilly and backward areas, to in order to provide the better care to the rural and hilly backward areas. So that is the reason this center was established for the rural people especially. Okay, in order to cover the, if they want to cover the 3,000 population for the general area. Okay, but rural, tribal or hilly where they have to cover the 5,000 population. Here in order to provide the like a more or better services to the rural population, the government is established the subcenter. Okay, so here the subcenter has to cover the 3 to 5,000 population. 3,000 only for the tribal and hilly backward areas. 5,000 population only for the general or plain areas. Okay, in these no beds. Okay, only 3 or 4 members, they may not stay, but they will only provide the outpatient services. Outpatient is nothing but they may not stay, the patient may not stay, like a staff also they may not stay in the hospital, like they may not provide the 24/7 services. Only outpatient services only they will provide at subcenter level. It's clear. So next, coming to the defined primary health center. Primary here, so this is also provide the integrated health services to the people, especially in rural areas. Okay. Okay, primary health center here also what they are asking here, functions. So sorry, define, no. So definition of subcenter here. So in order to provide the services to the rural population, here the like a PHC means it will establish in the location of the all the mandals. Okay, it's clear na. Okay, so in order to provide the more services to the mandal area, especially 20 to 30,000 population, 20 like a hilly, tribal and backward areas, 30,000 population, plain or general areas. It's clear. Okay, in these PHC only 6 subcenter. Okay, sorry, in this PHC 15 members are going to provide the services to the rural population. They have to cover the 20 to 30,000 population. So how many members are staff here? 15 members. It's clear. So here no one has written, so sorry for that. 15 members. Okay, PHC, so subcenter only 3 or 4 members workers will be there, and PHC 15 members, and CHC 25 members. You have to keep it in mind, ma. Subcenter 3 members, PHC 15, CHC 25 members. So here, but each subcenter, sorry, each PHC has to cover the 6 subcenters. Okay, one PHC has to cover the 6 subcenters. 6 subcenters has to, each subcenter has to cover the how much population? 3 to 5,000 population. So 3 into 5, okay, nearly 3,000. If you'll see 3, so 3 into 6, how much population? Nearly 20 to 30,000 population. It's clear na? Okay. Primary health center has to cover the 20 to 30,000 population. Each primary health center has to cover the 6 subcenters in these 6 beds. Okay. It's clear. Next, coming to the defined health team. It is defined as a group of persons who share a common objectives determine the community needs and towards the achievement of the which each member of the team contributes in accordance with her competence and skills and respecting the functions of the other. So here the health team. So a team is nothing but a group of people. They will working and they will communicating. They are coordinating in a successful way in the belongs to the health team responsibilities. Okay, here the group of people. So group of persons, who are group of persons, it may be doctor or staff nurses or lab technicians, pharmacists, and different workers will be there. Not only healthcare, not only these people, 4th class employees also will be there. Okay, this is a group of people. They have to work, they have to communicate, they have to coordinate to achieve a common goal. It's clear. So this is about the health team members. It's clear. Okay, if you want, you can copy this one also, but simply you can, if you want write, you can write it. Okay. Next, expand ASHA. ASHA means accredited social health activist. Next, write about the 108 services. Okay, 108 emergency response services was launched on August 15, 2005 in the Hayam of the YSR Rashekar. Okay. So during that time, there is not bifurcated the Telangana from the Andhra Pradesh. Okay. That is a United States will be the like a only Telangana and Andhra Pradesh only clubbed only one state. Okay. But after that only Telangana is bifurcated from the Andhra Pradesh. Okay. So this is a 108 services established in the August, okay, in the year of 2005. Okay. So the main intention of the 108 service is one of the emergency services. If you will make a call to 108, so they will come to you, they will take up to, they will reach to the hospital and they will provide they will provide the services to the people in order to save the life of the patient. This is a mainly motto of the 10. It is a 24 in 7 survey, 24 hours into 7 days emergency services for medical, not only medical, police and fire emergencies also. If you want, if you need any emergency, it may be medical or it may be police or it may be fire emergencies, we can utilize this number in Andhra Pradesh as well as the Telangana states also. The main highlights are it is a 24 into 7 emergency services, toll free number accessible from landline for mobile emergency. Okay, if you don't have mobile also, no need to worry. If you want to make a call to this number, you can use the from landline number also. Not only mobile, you can use the services with the help of the landline. Okay, to emergency, it will reach you in average for 18 minutes. If you make a call to this number within the fraction of time, nearly 18 minutes it will take the time to reach to you in hospital. Okay, so this is the main importance of the 104 services. Next, coming to the define fertility rate. Okay, general fertility rate. Fertility is nothing but able to conceive the children. Okay, the marriage couples, like couples, they may have the ability to produce the children. It is known as the fertility. The general fertility rate is also called as the general fertility. The number of labors per thousand women ages 15 to 49 in a given year. Only why we are calling 15 to 49 means, so this is period also we can, in some of the textbooks, 18 to 49 they are giving, but 15 also correct only, but don't write 18. If you want write, you can write 15 to 49. So this age group also we can call as eligible couples, EC. EC means eligible couples. So why we are calling as eligible couples means these eligible couples only have the ability to produce the children. Why they have the eligibility means 15 okay, 15 age group of the children, this is the last period of childhood to puberty age, we can call it as adolescence age groups. Okay, 15 years of age when the child, male child or female child also, if they will okay, so why we are calling as eligible couples age group means 15 to 49 years. Okay, when the girl child or male child also, when they will attain the 15, so they may develop the secondary sexual development characteristics, isn't it? So when they will attain the development of this 15 years, they may have the capability produce the children. If they will married also, we are observing also early marriages. If they will early marriages, so each girl child, they may have the capability produce the 10 members of children in their lifespan. Okay, so she may have the ability or capability to produce the 10 members of the children in their lifespan of the year. Okay, so that is the reason. If they will marry if the child will marry in early age, so she may produce so many members. If you'll see then in olden days, if you'll ask the any history from the grandparents, they will tell. So I have the 10 children and all. But nowadays, no one is interested to no one is interested. If they will marry also, she may have the capability of the 10 members in each lifespan of the year. So that is the reason. If we early marry, she don't have any capability, she don't have any maturity and all. So if they will do the early marriage for the girl child, she may have the so much of complications in early age. Okay, that is the reason. They don't have any physical maturity and mental maturity also. So that is the reason so many we are observing also, we are divorce cases, suicidal tendency, in order to she not cope up with the situation. That is the reason we have to avoid the early marriages. Okay, that is the reason I am telling here the general ability, like a general fertility rates means 15 to 49 age group we are calling as a eligible couples rate. Okay, so this is, so here the general fertility rate, the general fertility is the number of labors per thousand women ages 15 to 49 is in a given year. Number of birth in a year divided by number of women age group 15 to 49 years into 1000. Okay, next coming to the expand MDT. MDT is nothing but the multi-drug therapy. MDT is a treatment for leprosy. It's one of the drug of choice for the leprosy patients. So leprosy is nothing but it's a one of the very serious communicable diseases. It's mainly caused by the Mycobacterium leprae. Okay, this is one of the communicable diseases. It's clear. So next coming to the defense staff development. According to Karen J. Kelly, the staff development program is a process that includes both formal and informal activities which are related to the employees' role expectations with the organizations. Okay, in order to develop some of the skills among the staff members, some of the activities going on. The activities it's may be formal or sometimes informal also will be there. So formal means it's a systematically the activities going on in order to develop the methods in the staff in order to develop the communication coordination to in a success way. Okay, informal means like it's not a formal, haphazardly the activities according to condition they may implement the informal activities. It's clear. And formal means systematical. Okay, informal means without a systematic. It may be related to the employees and role expectations within the organizations. Okay. Next, coming to the define TBA. TBA in the villages, MCH services provided by the TBA. So, TBA is nothing but the trained birth attendant. Birth means to deliver the baby. Attendant means to help. Trained means compulsory she has to undergone for the training. Okay. See, in olden days, only Mantrasani. You are used to call it as a Mantrasani. See, Mantrasani, she never undergone for the like a training and all. That is the reason in olden days, so many like tetanus cases after delivery of the baby. Okay, they may not see the environmental hygiene, they may not bothering about the any umbilical cord scissors and so many aseptic techniques they are following. That is the reason if the mother may not have any complications before the delivery, but during delivery they may not follow the hygienic practices. That is the reason whatever they are using, like it may be scissors, umbilical cord, or different activities, different equipments. These equipments are prone to get the infection. So due to the infection, the mother also die and baby also get the die. So that is the reason the TBA is expanded, TBA is initiated. Okay, so TBA is nothing but the trained birth attendant. So okay, so here the mainly, so these are the main objectives of the TBA is means in order to reduce the mortality and morbidity among the infant mortality. Okay, I will show you infant IFA, infant IMA, infant IMR, and MMR. IMR and MMR means infant mortality rate, and MMR means maternal mortality. Okay, IMR means infant mortality rate. At the time of delivery, if the baby is died due to the so many complications, in order to reduce these complications of the baby, we have to follow the certain aseptic techniques. Who will implement these aseptic techniques? If you give the training to the any like assistants or any village health guides or TBA, so they may known where they may have the specialty, they may have the much knowledge how we can conduct the delivery with the following the aseptic techniques. So that is the reason we can reduce these complications. Okay, next one the MMR. MMR means maternal mortality rate. Not only dying the cases of the mother baby, the mother also having the so much of cases at the time of delivery. Is the reason. That is the reason in order to reduce the IMR, infant mortality rate, as well as the maternal mortality rate, if you are following the unless such aseptic techniques, definitely we can reduce this complication. That is the reason the government is initiated, given one of the notification regarding TBA. TBA is nothing but the trained birth attendant in the villages, especially MCH services provided by this one. So here the trained birth attendants means, so they may live in villages, they will provide the home delivery care and registration of antenatal mother and prepare for the mother and delivery. So not only registration of the antenatal mother, not only preparing the mother for safe delivery. So during the delivery also, so what are the precautions we should follow to prevent these cases? It's clear now? So next coming to the explain section B. Explain the principles of the management. So here the principles. So principles is nothing but the division of work. First D square, D 1 2 D3. Okay, first we will see division of work. Next, the discipline. Next, okay, next direction. Okay, D3 ma. First principles of the management. Okay, already I have told no, management is nothing but getting the things done by others. Okay, if you want to finish the work within the complications, some of the principles we need. So what are the principles? First one, the D3. D3 means first one is the division of work. Okay, so if the 10 members will be there, we want to finish the work within like a 2 days. So what we have to do? This we have to, within the 2 days means we have to divide the work among the 5 members. 5 members. So we have to divide the work by following the 10 members. So here the 10 members will be there. So how many teams we can frame? 2 teams. So 5 members 1 team, 10 and one more 5 members 2 team. Okay. So within the 2 members they can finish the work within 2 days. So that is the reason we should not allow the work for entire team. Like a 10 members will be there, no? So 10 member has to finish the work in 2 days means who will responsible? Nobody will bother. So that is the reason what we have to do. We have to divide the work by 5 members separate and 5 members separate. We have to give the instructions. These 5 members has to complete the work within 2 days. Okay, if you instruct seriously among the team members, definitely they will do the work. So always you should remember, we should not allow the entirely group. We have to divide the work among the team members. That is the first and foremost principle. Second one is the discipline. Okay, so they have to go in a smooth way. They have to follow some of the rules and regulations in a like a in systematical way. Next one is a direction. In team member, we have to allow the one of the team like leader. We have to give the instruction to the leader. So the leader will follow the instructions among the members. Okay, so that is the reason in each team we have to elect the leader. If whatever we are getting the authority, we have to pass the authority to the leader. Leader will follow the authority of ourselves. She will implement these the principles among the members. It's clear now. So these are the next one is authority. We have to give the instructions. If you are not doing the work, I will terminate from this job. If you will give these instructions, definitely everybody will do the work with like a responsibility. Okay, next, according to their work, we have to pay the salaries, we have to increase the salaries. It is known as remuneration. Okay, everybody has to do the work with interest. Okay, interest. If we will have the interest without putting efforts, we can complete the work within the time period. Okay, according to their work, we have to increase the salaries. Okay, remuneration, interest, and next line of authority. Authority means already I have told, no. So whatever I am getting, for example, I am the manager. So whatever I am getting the authority from higher authority, I have to follow this authority. I have to follow this authority from other people, and again same thing we have to pass this authority to the leader. Leader will implement this authority to the among the team members. It's clear. This line of authority should be there. Next, justification. We have to develop the all are equal. Don't show the any partiality among the team members. Okay. Next, we have to we have to provide the security among the job members. It's clear now. If anything happens to the, so they may not interest towards the work. That is the reason we have to provide the job security. Okay, and next, ability also everybody has to develop. Okay, so these are some of the principles of the management. Let me see. So here in this will be there, must see here, division of work. Okay, division of work, authority and responsibility. Okay, everybody has to accountable to their activity. Okay, okay, if you will divide the work, definitely everybody will have the authority. Authority means responsibility. If you have the responsibility, if anything happens to, the leader will ask you only. That much intention you should develop. Okay, authority and responsibility. Discipline, systematical way you have to finish the work. Okay, it's unity of command. Okay, if the leader may not have the command, nobody will listen. Okay, the manager has to give the command to the leader. Leader will implement this command among the members of the team. Then only everybody will success. For example, so I will give the some of the instructions. If I am there in the classroom, I will follow. I will follow all the things. If I may not there in the classroom, what will I will do? I will elect one team member, one leader. So I will give the instructions to the leader. She will follow the all the instructions from me. She will implement among the class members. Okay, so this is that unity of command should be there. Okay. Next one is the unity of direction. I have to give the directions. This is the way you have to follow. I will give the instructions. I will give the directions to the leader. So leader will implement all the directions among the class teacher, like a class members. Okay, within the fraction of time. I will give the work. You have to finish the work within the time of period. So same thing. Whatever I am giving instructions, whatever I am giving directions, she will implement based on the her class members. It's clear now? Okay, next, subordination of the individual interest and general interest. So here everybody will has to develop the interest. Without the interest you cannot do the activity. Okay, everybody has to get the interest among the work, among the members towards the work. For example, any activity will be there, any work, everybody has to get the interest. Then only, without complications, without headache, without stress also, you may finish the work. It's clear now? Next, remuneration of the personnel. Person means individual. Personnel means group of members. Okay, according some members, in some members they will do the work nicely. Some members they may not do the work. But here what we have to do? We have to see the activity of the members according the members who are not doing, who are doing. Okay, here remuneration according the caliber of the people, we have to increase the salaries. Okay, next, centralization. Okay, here the importance to the all the people. Okay, next, scalar chain. Scalar chain means like according to authority, we have to follow the from highest to lowest, from principal to the students. Like this we have to follow the scalar chain. Next, order. Whatever you are doing, it should be in order way, not in haphazard. Next, coming to the equality. So we should not show the partiality among the members. All are equal. Okay, next, stability of tenure of personnel. Okay, stability should be there. It should not flexible. Like we should, if you have any problem, until success you always stable. Okay, I have so much of work, how can I complete? But going on thinking means what you will do? You may get the headache. That is the reason, always be positive. Then only you may success in your activity. Next, initiative. Okay, initiation should be also there. Here employees and employed, whatever you are doing, the leader has to give the initiation within the team members. Next, coming to the escort the crops. Here the team spirit, already I have told the elements of the management. Spirit the crops means always you should develop the team spirit. I am also belongs to the team. Okay, if you have that tendency, definitely you will finish the work. Okay, so these are the some of the principles of the management. Next, write the functions of the WHO. WHO is the World Health Organization. Okay, it's a developing and developed countries in matters of the health. The main function of the WHO is the World Health Organization. All over India, if the any state or any country will have the problem, the WHO will eagerly provide the services to the country. Okay, it may be mainly health, especially it will provide the services in matter of the health. Okay, it funds health projects in the developing countries, health policies. The WHO will make the health policies which area to the adopted by the countries. It regulates the provision of health services. So WHO always it make the policies, not only framing the policies, it will also regulate the provision of health services. If the any country or any state having, it may be like a disasters will be there, a sudden occurrence of any problem like a tsunami, earthquake or floods, anything. So due to this, so many people will be suffer a lot. So that is the reason during that situation, okay, this WHO make a initiation and they will provide the provision for all the services. It may be supplying of the drugs, supplying of the shelter, supplying of the medicines, food products, and milk supply, milk packets and all. So many provisions they will provide the services who are in need in emergency. It's clear. Next, it is involved in disease surveillance and monitoring. Okay, it is involved in disease surveillance is nothing but the monitoring. If the sudden outbreaks of the diseases, what will happen, there is a chances of the getting the so many infections. Okay, not only supplying the medical appliances, so it will also monitoring of the problem among the members in a particular situation of the crisis. Next, okay, it is involved in health education and promotion. Okay, the WHO also educating health and promotion also. Okay, the WHO works with the governments of countries and promote health activities, administration and regulation of international health. Okay, administration is nothing but they will manage the area, they will manage the situation. Okay, and regulation, they will frame some of the rules and regulations of the international health. International health is nothing but the other countries. Okay, in some of the migration from like import and export. Okay, so this is the situation. So like in corona situation, so many people, other countries, they are also migrating from there to here. We are all the people, they are going to from here to there. So during the situation, if the any unknown cases like new cases will come now in airway and in quarantine, so they will inspect the conditions. If they will have any problem, they will inspect and they will isolate the patient until recovery of the condition. It's clear now. Next, publish journals, periodicals, any new cases. Okay, so they will publish the journals regarding health situations. Okay, next, coming to the describe about 104 services. 104, 10, we can also call it as ambulance services. Okay, this launched in the United AP in February 2008. Okay, it's a main providing PH services like treating chronic diseases, maternal and child health services to the public of rural and remote areas in the state. Okay, it's a mainly treating chronic diseases. Okay, and maternal and child health services to the public of rural and remote areas especially. Mobile medical units, 104 visits villages in fixed day in every month. They will conduct medical camps, screen the patients, distribute the medicines, refer those patients who require more medical attention to nearby area hospitals. Okay, they will also transport the patient with the help of the 104, 108 services. Not only distributing, they will also screening, they will also transporting the patients. It's clear. Okay, in every 104 team, there is medical officer to attend in emergency. Okay, staff nurse, one medical officer should be there, one staff nurse should be there, ANM, lab technician, pharmacist, vehicle driver. So these are all so many members are working in a 104 services. Okay, in sometimes one ASHA worker also she has to support by referring the cases. Okay, and next, this 104 services would be renamed as NTR Sanchara Vidyalaya. Okay, sorry, NTR Sanchara Vidyalayam in Andhra Pradesh state, not in Telangana. Okay, next, write the usage of vaccine carrier. Okay, this is the vaccine carrier should not be cracked. If they will cracked, we should not use for the storage of the vaccines. If we cracked vaccine carrier, we can use it, means what will happen, it may not maintain the temperature. If you not maintain the temperature, what will happen, if you use this vaccine to the beneficiary of the child also, it may not get any benefit from the vaccines. Okay, that is the reason we should not use any cracked vaccine carriers. Okay, dry the ice packs and keep inside. Next, frozen ice packs temperature should be less than 8 degrees centigrade. Keep all vaccines, okay, vials and ampoules in the polythene. Next, the vaccine carrier should not be keep under the sunlight. Okay, and next, coming to the should not be open the cover or lid unnecessarily. Whatever you want, Just only one time you have to open it, that one only you have to use it. Should not open unnecessarily in so many times. Frozen ice pack should be only used once. Should not sit on the vaccine carrier. Okay, but so many staff nurses, they will used to sit on the this one. So that's the reason. Not regular staff, student nurses, they don't know, no. That is the reason we should not sit on the vaccine carrier. Should not carry the vaccines in a cloth bag. Okay, so next coming to the, it's a tied container. Okay, so storage of vaccine carrier, dry the inside of the vaccine carrier after use. Check the cracks inside and outside of the vaccine carrier. Keep vaccine carrier in a cool place. Use frozen ice packs and keep the lid of vaccine carrier tightly. So it should work for 24 hours. If the power is not available, we can use this 24 hours. It's clear now? So next coming to the explain about the methods of the staff development. A person can grow individual by education. Okay, next, education is a continuous process. By this she can be able to reach her goal and also acquire good position in society. So some of the development methods will be the self instructional module. Okay, this will material, it's needed to stimulate the independent learning. Okay, next, continuous use of innovative methods. Innovative is always, it will give the initiation to develop our skills. Newsletters. Okay, this also Indian Nursing Journal. These are all the about methods. Staff development, skill development, in-service education. These are all the things will be there. You can write it. Seminars, guest lecturers, workshops, reading books, handouts, pamphlets. Okay, this is one. It's clear now? Okay, so now I am going to explain about Telugu version. Okay na? If you have any doubts, in ask in comment box. Okay, for English medium students. So briefly I have explained, I have given explanation latest model question paper in health center management for the MPHW second year students. Now I am going to discuss about the Telugu version. Okay na? So Telugu version లో ఉన్న వాళ్ళకి మనం ఎక్స్ప్లెయిన్ చేద్దాం. ఒకసారి నిర్వహణ యందు అంశాలు. నిర్వహణ అంశాలు అంటే ఏంటి? ఇక్కడ మనము ఒక ఇతరులతో పని చేయించి మనం అనుకున్న లక్ష్యం సాధించడానికి మనం ఏమనుకున్నామమ్మా? నిర్వహణ అనుకున్నాం. ఓకేనా? సో ఇందులో తాను, ఓకే, సో సారీ, మనము తెలుగులో మనం ఎక్స్ప్లెయిన్ చేద్దాం సపరేట్గా.